Good evening. Welcome to the Personal Assistance Services Council Tele Town Hall on Changes in IHSS. I'm Janet Heinrichs-Canterbury, and I'm the Coordinator for Consumer Outreach at the PASC. Live with us on the call tonight is Greg Thompson, Executive Director of the PASC. Greg has worked on disability and long-term care issues for many years, including over 20 years at Rancho Los Amigos Hospital in Downey. Greg, would you like to say a few words to welcome people?
Yeah, thank you very much, Janet. We're very excited that you guys called in. The good news is it looks like we have over 3,000 on the line. The not-so-good news is we're waiting for Holly Mitchell, but I'm sure she'll join us quickly. I'd like to welcome all the callers, and we're so excited that you're on our call tonight. PASC runs the county's largest registry for IHSS consumers and workers, and we do background checks and clearances for the IHSS providers, which is required by the state. We also manage the health insurance benefits plan for the LA County providers through LA Care. We offer extensive consumer trainings, and our Consumer Corps, which we recently started, connects consumers who want to learn more about the issues, mentor other consumers, and develop a relationship with their elected officials.
Thank you so much, Greg. Well, I hope Holly will join us, but let's go ahead and get started here. One of the things that we're going to do tonight, of course, is we're going to give you an opportunity to ask Greg and Assemblywoman Mitchell to be answering questions from you. So if you have a question at any time during this call, I want you to press *3, and you'll be connected to one of our operators who will take your question. And then you'll come right back onto the call. Listen carefully, though, because when we take audience questions, I may call your name and ask you to ask your question. Also during the call, I'm going to be asking some questions that we have for you, the people who are really affected by the changes that we're talking about tonight. So if you're not on IHSS and these questions don't relate to you, it's okay for you not to answer. Just bear with us while we ask these questions. So here's our first one, and I'm going to give you several choices, and I'll read them again, so if you miss it the first time, don't worry, you'll hear it the second time. So here are your three choices for this question. If you're on both Medicare and Medi-Cal, push number 1 on your phone. If you are just on Medi-Cal, push number 2 on your phone. And if you're just on Medicare, push number 3. Here are the choices again. If you're on both Medicare and Medi-Cal, push number 1. If you're just on Medi-Cal, push number 2. If you're on Medicare only, push number 3. Why don't we ask Greg to talk about the IHS settlement and the cuts. And when Assemblywoman Mitchell comes on, we will introduce her and have her make some comments. So go ahead, Greg.
Thanks, Janet. I don't know how many of you are aware of everything that's going on with the Affordable Care Act, but there's just so much happening in Los Angeles, and we're just so excited that we have you guys on the line. First, we're going to talk about the settlements. The recent, I don't know if you may remember, in 2009, the legislature approved a 20% cut in hours across the board for IHSS, and then the courts issued an injunction for those cuts. Just recently, a settlement was reached, and what it does is it replaces the 20% cut with a temporary 4.4% cut beginning July 1 of 2013. Now, this 4.4% cut is in addition to a 3.6% cut in hours that you've already had for the past 2 years. So that's how it totals the 8%. The total in 2014, the plan is to reduce that to 7%, and it would end in June of 2015. And the state is already working on some plans to try to reduce that 7% cut that will happen in 2014. Now, I know these numbers are confusing, so I'm going to repeat them again. Basically, you guys in 2011 suffered a 3.6% cut, and beginning in July, you will get an additional 4.4% cut. So that's how we come up with the 8%. Now, while this is nowhere near a 20% cut, at PASC we're very concerned about an 8% cut in hours. And it's these cuts, as I mentioned, and we're going to continue to fight eliminating these cuts. And there's a lot of studies out there, and we're going to be posting them on our website. So, and our website is pasc.org. So please feel free to contact us at any time. Thanks.
Thank you, Greg. We're still waiting for Assemblywoman Mitchell, but I'm going to take this opportunity to give a plug for my Consumer Corps, because one of the things that we need to do.
This is Assemblywoman Mitchell. Can you hear me?
Yay, you're on. Hi. Welcome, welcome, welcome.
I heard the introduction. I heard you have 3,000 callers, and I was stuck I was in a technological vortex. I could hear you, but you couldn't hear me. Please accept my apologies.
Oh, that's okay. That's okay. So I could say a few words about you. You're just, you've done so many wonderful things. You actually happen to be my assembly representative. So, and you chair the Assembly Budget Subcommittee that has overseeing of IHSS. So you are really a wonderful champion for IHSS, and I wonder if you have anything to add to what Greg said about the cuts, Assemblywoman Mitchell.
Thank you so much for the opportunity, and I'm thrilled to be able to participate on this call, with the goal being to try to provide as much clarification as possible as we can to IHSS consumers. I've had a really tough job the last several years. I've had to oversee a budget subcommittee that's had to hear really important testimony from consumers and providers alike, and as a member of the legislature, had to make tough decisions to try to balance out the entire state budget when we had huge, huge deficits. But I'm very happy that the administration was able to negotiate a set of cuts that will lessen the blow to the consumer population. As he just stated, 8% isn't anything to celebrate, but it's a lot better than the 20% that was on the table.
Right. Thank you so much. And thank you too, Greg. Remember, if you want to ask a question of either Greg or Assemblywoman Mitchell, just press *3 and one of our operators will take your question. Now, before we take questions from you, I want to ask you another question about how the cuts will affect you. Remember, if you're not an IHSS, it is okay not to answer the question. I'm going to give you 4 statements so you can listen to all of them and then choose your answer. Here they are. When my benefits are cut 4.4%, I'm worried that I won't be able to participate in work and community activities. Press 1 if that reflects you. When my benefits are cut 4.4%, I'm worried that I won't be safe in my home. Press 2. When my benefits are cut 4.4%, I'm worried that I will have to go to the emergency room more. Press 3. When my benefits are cut 4.4%, I'm afraid I'll be forced to live in a nursing home. Press 4. I can read those again real quickly. One of them, the first one is press 1 if when your benefits are cut 4.4%, you're worried that you won't be able to participate in work and community activities. Press 1. When my benefits are cut 4.4%, I'm worried that I won't be safe in my home. Press 2. When my benefits are cut 4.4%, I'm worried I will have to go to the emergency room more. Press 3. And when my benefits are cut 4.4%, I'm afraid I will be forced to live in a nursing home. And press 4. Now, thank you all for answering those questions. Now we'd like to take questions from you. So let me see what we have here. I'm sorry. Okay, we have a question from Gary I don't see where you're from, Gary, but are you there? All right.
La Puente.
Where are you from?
La Puente.
Oh, okay, La Puente. Very good. So what is your question, Gary?
The question is that it's going to be bad if you cut our hours, because like I say, I don't want to go to no board and care home. I've lived in them. I paid my dues. I did my share. Why don't we tell these legislators to put more money into in-home support service so we can live there? It's cheaper for us to live in our own home than it is a board and care home.
Thank you very much, Gary. Thank you very much. Assemblywoman Mitchell, would you like to answer that question?
I would be happy to. And let me say, Gary, I could not agree with you more. Absolutely. I couldn't agree with you more from a variety of perspectives. Number one, as a person who supports maintaining people in their home where they're most comfortable. And secondly, as a legislator, because it's more cost-effective, to be perfectly honest. When you consider nursing home and boarding home care rates, it's much more expensive. The challenge is this, if I may kind of summarize very quickly. The state has had a deficit for about 10 years. The general fund, which is basically the state's checkbook, it's how we pay our bills, is at the same level it was in the mid-1970s. With the stock market crash, the housing market crash, the Silicon Valley crash, the state of California just isn't earning the same level of income it has in more recent years, nor are we earning enough income to really, quite frankly, pay all of our bills. And unfortunately, over about the past 10 years, the only way we've been able to have a balanced budget, which the state constitution requires that we do, we've had to cut because we didn't have two-thirds majority to agree on increasing taxes or increasing fees, which is the way the state can earn more income. It is tragic. I couldn't agree with you more. And so the only way we've been able to balance the budget is to cut deeply into critical health, social services, education, and public safety services for all of California.
Thank you very much, Assemblywoman Mitchell. Greg, did you have anything to add to that? I'm just going to go to the next question if you don't. All right, so we have a question from Kanda in Tahunga. Kanda, are you there?
Hello?
Yes, hello, Kanda. Can you tell us what your question is?
Yeah, I know this is a funny question, but so they didn't vote to take money away from the rich, and so they're going to take it away from us, the poor people, correct?
Well, it's not a funny question at all.
I know it's
Kanda.
not, but you're laughing because
Kanda.
Well, I'm laughing, frankly, Kanda, because to be honest, I agree with you. And, you know, politics, you know, can be tough. You know, I represent the 54th Assembly District, and I represent mostly working class people who I think agree with you and I. And I have to recognize that some of my colleagues on the other side of the aisle represent different constituencies with different perspectives. And so trust me, if you have access to the Cal channel, you can watch your California legislature really engage in tough debates about what's best for California. And we've tried to figure out a way to close various corporate tax loopholes, and we did pass Prop 30, which allows us to tax at a higher rate higher income Californians. And so quite frankly, thanks to the passage of Prop 30 where the state can earn more income, we were able to avoid the 20% cut to IHSS. So I agree with you absolutely. And we just couldn't get enough legislators who were willing to close some of those corporate tax loopholes and tax at a higher rate, higher income individuals to bring more money into the state's general fund. We just weren't
Thank you
successful
so
in making that happen.
Thank you. Thank you. I wanted to take advantage of my position here and just ask a question. There's a question here from, I don't actually see the name, but the person is asking what the PASC has to do with Medi-Cal, and I wondered if Greg could respond to that.
The Personal Assistance Services Council is all about IHSS, and IHSS is funded by Medi-Cal. And one of our missions at PASC is to not only manage and try to coordinate the IHSS services in Los Angeles County, we also want to try to enhance the lives of people that are on IHSS, and those would be people on Medi-Cal. So we do try to educate the consumers about anything related to Medi-Cal and healthcare.
Okay, thank you. So I have a question here also, which is, I have a question from Linda. I don't know where she's from. Linda, are you there?
Yes, ma'am.
Okay, go ahead with your question.
Yes, ma'am. I'm suggesting if they continue to keep cutting, I'm in a scooter chair, and I had mentioned that when it rains, you can't go out in your scooter chair because, it doesn't work with electricity. But if there's no one here to go shopping for me, then that means there's a hardship, and I won't be able to eat for a couple of days because, my caregiver has less hours.
Okay, so let me see if Greg wants to talk about, respond to that. Greg, are you there?
Yes.
Thank you.
I think that, that's, as we mentioned earlier, the 8% cut is going to create a hardship in so many areas. And it's important that we hear your concerns and your questions so that we can take these to the legislature and hopefully we can make some adjustments. It's a very scary thing for people on IHSS. But it's my understanding that the settlement that just happened, both sides have sort of agreed in good faith to kind of leave the IHSS program stable for the next, at least in the near future. So hopefully we won't be seeing any more cuts for a while.
Thank you. Greg, here's another one that I think you would be helpful on. It is from Long Beach, Rusty. Rusty, are you there?
Yes.
What is your question about doctors?
I get 1.5 hours a month for my worker to take me to doctors, which isn't usually a bad thing. But if they're going to change my prescriptions or there's anything new, or like I had a surgery that was botched and now I have to go from Long Beach to USC, I've already been there twice, and I either have to give my worker time off of working in the house or shopping for me or helping me bathe and things in order to pay for her gas, and she definitely, or pay her out of my pocket, and she doesn't want to make any more trips to USC, and I still have 2 trips plus the surgeries. What do I do?
So, Greg, can you...
A little later in the call.
May I say something else? I'm very grateful for all the help I get.
Very good. Thank you so much, Rusty.
Janet, if I could take that question, please.
That would
Rusty,
be great.
Later in the call, when we're talking about a new program, Cal-MediConnect, one of the things that the managed care plans are going to be providing is non-emergency medical transportation. I'm not 100% sure if that will be able to help you out, but I think potentially you'll have an opportunity to go to the doctor with the health plans paying for it.
Very good. Thank you, Greg. Greg, here's another one that I wonder if you could address. Are you taking, it's a question about the way the 8% is computed. Is it 4.4%, that's all, or is it 8%, or is it 3.6? Can you just go through those numbers again real quickly?
Sure, and I apologize if I wasn't clear the first time. You've already had your hours cut 3.6%, and so what the state is trying to do is, instead of restoring your 3.6 hours and then cutting you again 8%, they're trying to time it so that they just add the additional 4.4% cuts beginning in July of 2013. So if everything goes right or wrong, July 1st, your hours will be cut in 4.4%, totaling the 8% in the settlement.
Okay, and then you just answered one of the other questions that's prominent here, and that's when's the actual decrease going to go into effect? They'll get the notice on July 1st, Greg, and then when does it go into effect?
The cuts would begin in July of 2013.
Okay. All right. Thank you so much. Those are really very good questions, and I'm sure there are many more. And remember, you can ask a question at any time in this call by pressing *3, and the operators will take your question. And if we don't get to it tonight, we'll get to it in the next couple of days. And the other way you can deal with your questions is to go to the PASCLA.org website, and you will be able to submit your questions there. We have a Facebook page, and we also have information on so many of the other organizations and resources that are out there for you on this issue. So I'm going to do another quick polling question. Assemblywoman Mitchell, did you want to add anything else on the cuts in the settlement?
I'm just glad that the callers are asking for the clarification so they understand that it's not an additional 8, but it's 4%, 4% on top of the 3% they've actually experienced. And I deeply appreciate kind of the real-life examples. I get to hear from consumers, those who are able to travel to Sacramento and come to the budget hearings, to really talk us through what these numbers mean in real life. It's one thing to think about an 8% cut, but to hear the caller say, if it's raining and I'm in my scooter, I can't get groceries, and to hear the last caller talk about how do I manage these doctor appointments with reduced hours, that's very, very helpful, and I appreciate them taking the time, and I appreciate PASC for setting up this call so we can all learn about these policy changes and the consequences together. Thank you.
Thank you. So let's go to our next polling question. And remember, if you're not on IHSS, you do not need to answer this question. Here are the choices. How would you like to get information on changes like those that we're talking about tonight? First choice, if you'd like to receive information in the mail, push 1. If you'd like to receive information via telephone, like tonight's call, press 2. If you'd like to receive information from a live person, by talking with a live person, press 3. If you'd like to receive information by email, Facebook, or website, push 4. And if you'd like to attend meetings where information is given by presenters, press 5. Here they are again. If you'd like to receive information in the mail, push 1. If you'd like to receive information via telephone, like tonight's call, push 2. If you'd like to receive information by talking with a live person, press 3. And if you'd like to receive information by email, Facebook, or the website, push 4. If you'd like to attend meetings where information is given by presenters, press 5. Okay, now I would love to ask Greg if you could start out the conversation about Cal-MediConnect.
Thank you, Janet. As I was mentioning earlier, there's so much going on, and I'm hoping that you guys have heard about this, but there's a new through the Affordable Care Act, California has been chosen to participate in what they're calling Cal-MediConnect, and it's designed to improve health outcomes for its consumers, contain costs by combining the Medicare and Medi-Cal funding, and then better coordinating the services. In LA County, there are approximately 360 individuals who have both Medi-Cal and Medicare. Beginning in October of 2013, LA is going to enroll 200,000 of these individuals into a managed care plan. If you have both Medi-Cal and Medicare, you're going to be asked to choose from one or two of the managed care plans for both your Medi-Cal and Medicare benefits. They're going to include not only your health care, but your mental health, IHSS, community-based adult services, and multi-purpose senior services, and also nursing home care. Plus, as I mentioned earlier, there are going to be some additional things available, such as dental and non-medical emergency transportation. It's important to note that you're going to have an opportunity to stay with your Medicare providers if you choose. In other words, you can opt out of having your Medicare into the managed care plan. However, all of your Medi-Cal services, including IHSS, will be provided by a health plan, so you will therefore have to select a managed care plan for your Medi-Cal services. If you don't, one will be selected for you. Around July 1st, you're going to start receiving notices from the state of California telling you about these programs. You'll also be receiving notices, information from the managed care plans in Los Angeles County. And these two plans are HealthNet and LA Care. August 1st is when you should see those notices, and again in September 1, telling you more about the services that the health plans provide. Beginning in October of 2013, there's going to be a 3-month open enrollment for anyone who has Medicare and Medi-Cal. During this open enrollment time, you'll be able to choose a plan, either HealthNet or LA Care. So it's important that you start looking at these plans now. After the 3 months, we will go into a 12-month, what they call passive enrollment, at which time you will need to choose a plan. Now, if you don't choose a plan, you will be put into one of the managed care plans during this period. And the state will try to look at your history and try to find a plan that suits you. But again, it's very important that you choose a plan based on where your doctors are. And again, you will be able to opt out of the MediConnect anytime you want for your Medicare services. Even if you opt out of the Medicare, though, you're still going to have to select a plan for your Medi-Cal, for IHSS, and any other community-based adult services and nursing home care. And as I mentioned earlier, it's important that you learn as much as you can about Cal-MediConnect, and there's a lot of information about this decision, and we'll be posting it on our website. Recently there was a presentation done by the California Healthcare Foundation, and their study is called Experience of Seniors and People with Disabilities Who Transitioned into Medi-Cal Managed Care. And this study concludes that they've learned some very valuable lessons, and there's still some lessons that need to be learned. And so that's an example of things that we'll be posting on our website.
Thank you so much, Greg.
let me just add that some people will be exempt from Cal-MediConnect. And to find out if you might be one of those, please contact PASC 877-565-4477 or go to our website, pascla.org. And we will continue to try to update that with information. So I'm going to stop now and give it back to you, Janet.
Thank you. Assemblymember Mitchell, would you like to talk about MediConnect a little bit, about the processes that you saw happen in Sacramento and what your wishes are for the program?
Yes, that would be great. Thank you. It's an important way that, if done well, will allow us to coordinate medical, behavioral, and long-term services from Medi-Cal and from Medicare through a single managed health care plan. So it's a huge change, but I think that, once all the consumers understand how it applies to them, once everyone has made the transition, in theory it should work well and be more efficient and consumer-friendly. I say in theory because it sounds good on paper now. The challenge will be in practice. And so I want to continue to hear from consumers. I want to hear from my constituents and people all over California who will be in the MediConnect program to make sure that our concept of what works is actually indeed what works best for them. That's going to be the important part. And so the question you asked earlier about how people would like to receive information, it's really going to be important that you help inform the policy that affects your life. And staying connected with PASC and reaching out to your elected officials to educate us on if it's working, if it's not, what we can do differently and better is really important.
Thank you so much. I'm going to ask another question right now, another polling question, and you have two choices this time. Here's your first choice. If you don't need help with your medical and personal care, including IHSS, press 1. If you would like help with your medical and personal care, including IHSS, press 2. Again, here are your two choices. If you don't need help with your medical and personal care, including IHSS, press 1. If you would like help with your medical and personal care, including IHSS, press 2. Now, remember, at any time you can push *3 on your phone and talk to the operator. Give her your question for Greg and Assemblymember Mitchell about Cal-MediConnect. Let me see if we have any questions on the board right now. Here's one from Kathleen. She says, can we no longer use our own health care provider like Kaiser? Is that something you can answer, Greg?
Yes. I know that in L.A. County, they're working on contracting with Kaiser. So HealthNet and L.A. Care are the two main plans, but each one of them subcontract services. So I think it's important that if you have Kaiser, that you contact us or contact either L.A. Care or HealthNet and get that question answered. If your provider is not in either HealthNet or LA Care, and this is your Medicare provider, they would need to join HealthNet or LA Care's network, or you could always opt out of the program and stay with your fee-for-service doctor on the Medicare side. Let me repeat that. The Medicare. So if your doctor is being funded by Medicare, you can choose to stay with that doctor.
Thank you. So I don't know about you all, but this is all very, very overwhelming, and there are lots of details. So I'm going to reinforce what Greg and Assemblymember Mitchell have said, and that is to keep in touch with PASC. Go to our website. There are so many organizations that are working on these issues. There's one organization called the National Senior Citizens Law Center, and they're actually having two webinars coming up, one on April 22nd and one on May 7th. And if you go to our website, we have links to their website so you can register for that webinar. And all of these different sources of help and information will help you make a good decision for yourself. Now let me take another question. Here's a question from Deborah. She has a 661 area code, so she might be up in the valley, up in the Antelope Valley. Deborah, are you? Deborah,
yes,
are you
I
there?
am. Hello, I'm here.
Okay, good. What's your question, Deborah?
Yes, well, first I just wanted to say thank you to Assemblywoman Holly Mitchell for even being here and being such a champion for our cause. I really appreciate that. But my question is, you mentioned earlier that there just isn't enough money in the state budget to pay the bills, and I understand that. But what I want to know is what's being done to bring in new sources of revenue. For example, increasing taxes on those disgusting cigarettes or liquor. Okay, so that's my question.
That's a great question, and thank you. And as I said earlier, California voters who voted for Prop 30, that was one very, very important step. That allowed us to, increase sales taxes on ourselves for several years, as well as increase the income tax rate the highest income earners pay for the next several years. And in order to pass a new tax, a new fee, anything that looks like a tax, it requires 2/3 vote, not a simple majority, but 2/3 vote of the legislature. And sometimes that's where we get hung up. We just don't have enough, quite frankly, like-minded thinking legislators who are willing to pass taxes. Sometimes people think the tax is a four-letter word, if you get my drift. But there are lots of conversations. There's discussions around something called oil extraction tax or oil severance tax, where we can tax oil companies for pulling oil out of the ground. We've passed taxes, what they call sin taxes. We've passed taxes on cigarettes. And so there are a variety of issues and opportunities that are going to the legislature now that you'll begin to read about in the paper that will create ongoing opportunities for us to earn more income. And based on, Monday was tax day when everybody was supposed to file their income taxes, and the early projections we're getting is that the state's economy really is in a state of recovery. New home sales are back up. Unemployment is beginning to dip down a little bit. And so we think once the controller gives us the final word on what the state collected as a result of us all paying our income taxes on this past Monday, hopefully that will be good news and there'll be additional resources for us to be able to allocate to these critical programs like Cal-MediConnect and IHSS.
Thank you so much. Assemblymember Mitchell, I'm actually working you hard tonight. Here's another question that I think you would be wonderful to answer, and I'll try. My bias. You're my assembly member, so I'm making you work for your money here. Why can't the cuts come from somewhere else? I've had this question a lot.
Well, that's a very good question, and like I said, if anybody can tune into Cal Channel or go to Cal Channel on the internet, they can watch their legislature in action, and you can see us in Budget Committee and the subcommittees really trying to get to the bottom of this. And as a legislator, that's basically one of our primary functions is working the budget process and passing the budget. And there are competing demands on the budget. What does the state pay for? K through 12 education, some roads, Department of Motor Vehicles, Employment Development Department, so many of these important services, Medi-Cal, foster care, the list goes on and on. And so it's like, as I said earlier, if your personal checkbook, it's 2013, you're trying to pay your expenses based on income you earned in 1972, and your family size has increased by several million people. So there's so many competing resources that as your elected officials, we need to hear from you and make the best decisions we can with the limited resources. I always appreciate IHSS consumers coming to our budget subcommittee so they can give the legislators a real-life picture of why this program is really, quite frankly, life-saving. And again, we took horrible cuts to Health and Human Services over the last several years. The elimination of the Adult Day Health Program, a 10% cut in the Medi-Cal program, 10% cut in a lot of the durable medical equipment and supplies. So none of these were easy decisions that I had to make, or any other elected official for that sake. But really, I always felt like my back was against the wall, and without the ability to garner enough votes to figure out a new tax to get new money into the general fund, we did the best we could with the circumstances in front of us.
Thank you so much. I see a question here that, Greg, you might be able to respond to. What will happen to providers when they lose their hours? What will happen to their health benefits?
One of the things that PASC has done is we looked at how the 4.4% cut would affect the providers' eligibility hours, which are currently 77 in order to get onto the health plan. And we've asked LA County to lower the eligibility to 73 hours. And so hopefully we will be able to get that to the Board of Supervisors for their approval so that they don't lose their option to join the health plan. And then there'll also be changes coming with California Health Exchange and some changes to Medi-Cal. So there should be a variety of options for providers.
And if I may add, that's the one piece of good news that I can talk a little bit about very briefly, is the Affordable Care Act, or Obamacare, that did pass at the congressional level, that will bring millions of dollars into the state of California to allow us to expand access to health care services for many people who didn't have it previously. That's the one piece of good news that I'm proud to say that we're working hard every day to create and expand the existing Medi-Cal program and create a private program with subsidies to help low-income, working, and just low-income Californians to get access to health care. That's one piece of good news we can share.
Thank you so much.
And Janet, if I may, another good piece of news is the Community First Choice option, which California applied for with the help of SEIU and a lot of other people, and we were granted additional funding there. So that's helped to ease some of the cuts as well.
Great. I have a live question from Casey in Long Beach. Casey, are you there?
Yes.
What's your question, Casey? We only have a couple of minutes. Go ahead.
For years and years, my workers had trouble getting paid, several of my workers, and I know others have had the same problem. IHSS goes 3, 4, 5 months without paying them at a time every single year. Is there something that can be done about that?
One of the things that you can do is call PASC. We've created an issue resolving team, and we take these questions and problems, and together with DPSS and SEIU, United Long-Term Care Workers Union, we address those issues. So anytime you have a problem like that, please give us a call, and we've had pretty good results when the three of us all get together. And another new program that will be coming out, there's a brand new payroll program that will be starting later this year, and that should improve the payment issue as well. Thank you for your question.
Yeah. Thank you. Thank you all for your questions. So I want to ask you another question right now. We have just a few minutes left, so this is actually our last question. How can the PASC better help you? This goes to some of those questions that you all have been asking. If you would like more education classes, press 1. If you want more help finding a provider, press 2. If you would like 24-hour emergency help, press 3. If you need help in connecting with your elected officials, press 4. Here are the choices again. If you would like more help, more education classes, press 1. If you want more help finding a provider, press 2. If you would like 24-hour emergency help, press 3. And if you need help in connecting with your elected officials, like Assemblywoman Mitchell, please press 4. Now, I'd like to see if Assemblywoman Mitchell has anything to say in closing. We're almost out of time.
Let me very briefly say that you two are two of the hardest working advocates that I have the pleasure of working with and know, and that I really hope that the consumers on the call will continue to reach out to the Personal Assistance Services Council there in L.A. County to get critical, up-to-the-minute information on your IHSS program. I hope that you'll consider continuing to do these Tele Town Halls. You know, how else could we have a 1-hour conversation in the middle of the week with 3,000 people? This was a great idea, and I appreciate you including me.
Thank you so much. You're absolutely right. It was a fabulous idea. And I want to put another plug in real quickly for our website, www.pascla.org. And then I'm going to ask Greg, do you want to make some comments to close the call?
Well, first I'd like to thank Assemblywoman Holly Mitchell for not only being on this call, but she suggested we do this robocall. And we certainly want to hear from the 3,900 that are still on this call, but maybe you could space it out so you don't blow our phones up.
I can't believe it.
It's really, it's really important that, we can get the word out and that you guys start to try to educate yourself to everything that's going on. If you have further questions, you can press 9 and leave a message for us, and you can continue to let us know if you'd like us to continue to do these things. And also, as Janet mentioned earlier, we've created a consumer corps where we've enlisted the help of people who are actually on IHSS and know the program, and they're able to go out and help others and mentor them on IHSS. Thanks again, Assemblyman Mitchell. You really rock for doing this.
Thank you so much.
Thank you all so much for being on the call tonight. And again, call our number, 877-565-4477. If you have any questions after tonight, or you can press the number 9, star 9, on your phone right now and leave us a recorded message. And we will get back to you in a couple of days with an answer. And you can go to our Facebook page and leave a question. And, we are just so happy to have all of you on the call. Your questions are absolutely wonderful. And we really appreciate having your input into what we're doing and your direction in what we should do in the future. So have a lovely evening. Good night. Thank you.